we're going to see Eva Romero today. So she's a sweet 80-something-year-old lady who I started seeing about 2 years ago. We're going to head straight back like we usually do. And she had some pretty serious side effects to her insulin that caused her and her family a lot of concern. So she came in to start seeing me, and we were able to change up a lot of her medications. So we're headed straight back to that office and make sure she wasn't having the side effects that were scary to her. For Eva, just being able to have time to talk to a provider about her diabetes was really helpful for her. I think we've been able to develop a really fun relationship. She had a great granddaughter at the same time I had my first child.
How cute! My goodness.
And so we sort of have similar things going on in our families. And by access to pharmacists, a patient's often able to come here and see someone, easier access if they have a long wait to get into their primary care provider. So hopefully through that we're preventing emergency department visits and hospitalizations. I get a lot of time with the patient, so an hour for a first visit, which is significantly longer than the time that they would be able to have with their provider. And we're really able to dig into what's going on in their personal life. Patients who've seen a clinical pharmacist have a pretty large decrease in their hemoglobin A1C, which is that number that tells us how well controlled a patient with diabetes is. As a trend in the research is when patients have better controlled diabetes, they're in the emergency room less frequently, their overall healthcare costs are less, we're preventing heart attacks, strokes, amputations, kidney disease, so there are a lot of things that we can prevent.
It's a big difference. A doctor, all he does is ask you, how's your sugar, and you know, what is it, and you don't have high sugars anymore. And that was ever since she started with me.
Oh, I love it. I just love it because I don't worry about her. I've seen how much she's improved with her diabetes, and she can still live on her own, and she takes care of herself. She puts all her pills in her planner.
As a pharmacist, I have the skill set and knowledge to be able to change them to a medication that will work just as well, but have a different side effect profile, or we're able to mitigate some of the side effects through just timing of dosing. And Salud's Transitions of Care program has overall shown a reduction in the number of repeat 30-day hospitalizations. So that's the wonderful work of our Transitions of Care program, and we're trying to utilize pharmacy students with that program so that we are able to reduce hospitalizations related to medications.